After the coronavirus disease, tuberculosis is the second leading cause of death from an infectious disease. It claims approximately 1.8 million lives every year across the globe. About 1/3 of humans are infected with dormant tuberculosis. However, only 5 to 10% of these infections develop to active and severe tuberculosis. Tuberculosis is a deadly infectious disease caused by a bacterium called Mycobacterium tuberculosis. It primarily affects the lungs but can also spread to other parts of the body. Tuberculosis is primarily spread through the air when an infected person coughs, sneezes, or even talks, releasing tiny droplets containing the Mycobacterium tuberculosis into the environment. Droplets containing the Mycobacterium tuberculosis can remain suspended in the air for several hours, making airborne transmission highly efficient. When a healthy individual inhales these droplets, they bypass the upper respiratory defense and settle in the alveoli, the tiny air sacs within the lungs. When the bacteria enter the alveoli, the body's immune system recognizes them as foreign invaders. Highly specialized immune cells called alveolar macrophages are the first line of defense. These macrophages attempt to capture and destroy the tuberculosis bacteria through a process called phagocytosis. Macrophages are a type of white blood cell that feed on harmful pathogens. Once inside the macrophages, digestive enzymes are released to break down the bacteria. However, Mycobacterium tuberculosis is not easily destroyed. It has evolved complex mechanisms, which makes it resistant to the digestive enzymes inside the macrophages. Instead of being destroyed, the bacteria can multiply inside the macrophages. Over time, they can cause the macrophages to burst, releasing even more bacteria into the lung tissue, where they infect new macrophages. This leads to the recruitment of other immune cells to the site of infection, resulting in the formation of a structure called a granuloma. A granuloma is composed of infected macrophages, which have been surrounded by other immune cells. The granuloma helps contain the bacteria by creating a wall around them, indirectly limiting their spread and preventing damage to the surrounding tissue of the lungs. However, the granuloma can also provide a niche where Mycobacterium tuberculosis can persist in a dormant state for a long period, leading to latent tuberculosis infection. Latent tuberculosis infection occurs when the bacteria remain contained within the granulomas and do not cause active disease. Latent tuberculosis is recognized by the absence of symptoms and its non-contagious status. However, latent bacteria can reactivate under certain suitable conditions and lead to active tuberculosis disease after months or even years after the initial infection. Conditions like HIV infection, diabetes, malnutrition, or the use of immunosuppressive drugs can weaken the immune system, destabilizing the granuloma structure. This allows Mycobacterium tuberculosis to escape and proliferate, leading to a reactivated tuberculosis infection. During reactivation, the bacteria spread beyond the granuloma, causing extensive tissue damage and inflammation of the lungs. During this stage, the symptoms of active tuberculosis such as persistent cough, chest pain, coughing up blood, fever, night sweats, and weight loss begin to occur. Though the lungs are the primary site of TB infection, Mycobacterium tuberculosis can spread to other parts of the body, causing active pulmonary tuberculosis. This occurs when the bacteria enter the bloodstream or lymphatic system. Active pulmonary tuberculosis can affect the bones, kidneys, and even the brain, leading to serious complications such as tuberculosis meningitis. Tuberculosis is treated with a combination of antibiotics over a prolonged period, usually 6 months or more. Due to the resilience of the Mycobacterium tuberculosis, patients must follow the full course of treatment to prevent the development of the highly fatal drug-resistant tuberculosis strains. Drug resistance in TB primarily arises due to mutations in the Mycobacterium tuberculosis genome that alter the bacterial response to antibiotics. Preventive measures include the BCG vaccine, which provides partial protection, especially against severe form of tuberculosis in children. Other preventive strategies focus on reducing transmission through early detection, isolation of infectious cases, and improving living conditions. Overcrowded and poorly ventilated environments facilitate its transmission, making prisons, refugee camps, and urban slums particularly vulnerable settings.